Well, across the city, many advocates have rallied for birthing justice, fighting maternal mortality, especially for Black and brown women.
And News 12's Aisha McKenzie is taking us into a simulation lab within the NYC Health and Hospitals system that's meant to not just treat life-threatening childbirth situations, but structural racism in medical spaces.
Now, we want to note for you what you're about to see is a simulation, but it may seem graphic to some.
Oh my God, it's too much. I need help. Oh my goodness. That looks like a lot.
This is how the labor and delivery team at New York City Health and Hospitals Bellevue prepares for an emergency. The patient, their issues, their health, the only focus.
And as you just saw, it felt like a real-life emergency as the team from Bellevue Hospital rushed in here to help Candace. Now, that is the purpose of the obstetric simulation lab, and there are 6 of these across all city hospitals. And the focus in these labs is hands-on experience.
What's your feeling? Do you feel pressure, like it's time to push?
The beauty of sim, especially in such a great sim center like we have set up here at Bellevue Hospital, is that it recreates that high-intensity, high-paced atmosphere.
When mom and baby are in crisis, the simulation labs at all trauma centers in the health and hospital system tackles it all, preparing staff to treat and handle the worst-case scenarios.
So we simulate a variety of OB emergency topics, such as hemorrhage, maternal hemorrhage, which is the leading cause of maternal mortality, especially in New York City. We simulate difficult births, such as shoulder dystocia, and that's when the baby is delivered, but the shoulder gets stuck behind a maternal pelvic bone.
The simulation also tackles implicit bias and structural racism that can hinder proper care and treatment. And this is part of the city's mission to improve pregnancy outcomes, especially for women of color.
We have brown and Black women that we serve every day. Even if we're taking care of these patients regularly, we still have implicit bias, and having a safe and protected space to talk through that is really important and has been huge in my residency training.
Black women in New York City are 12 times more likely to die of pregnancy-related causes. And this is according to reports from the city's health department. And the Bronx seeing the worst outcomes.
We learned that, we have to pay attention to the patients and advocate for the patient.
And after each sim, the team debriefs.
We can grow, share, and learn together.
We want to have all of us have a shared mental model and hear all the concerns.
The simulations are run by the Maternal Mortality Reduction Program team of 4, going to each hospital for trainings. And according to them and others involved, care is improving.
We're really trying to dig into the metrics, and with our electronic medical record, we're really trying to show the bang for our buck in a way, because we really want to go ahead and shout from the top of the rooftops, like, practicing is what's going to make the difference, and we're going to actually try to impact care.
Training that we offer is really going to be a game changer for New York City. This is going to continue a major culture shift.
Thank you guys so much, because I feel so much
A culture shift that many have been fighting for. Aisha McKenzie, News 12.